Hello, hello. Are we ready for today? So, sorry. Good afternoon, everybody. My name is Jane Annie. I'm a consultant clinical pharmacist. And on our series on hypertension today, we'll be discussing, we'll be discussing smoking, right? This is not a topic that so many people would love to hear. I know that, and it's not a very popular topic, but we know a lot of people actually struggle with quitting smoking. So as part of our hypertension series, we are going to discuss smoking, how it affects your life, and most importantly, how it affects your blood pressure. So we already know what smoking is. People smoke different things: hashish, cigarette, cigar. You see, but our focus today will be on cigarettes, right? Cigarette contains majorly nicotine, but there are other components of cigarettes. People say, oh, it's better to smoke cigarette than to smoke weed. These are all psychoactive substances in their own strength and capacity. And I don't think there are enough evidences to say, oh, this one is less harmful than this. The amazing thing about smoking is that most people who smoke, they know it's damaging to the health, but they go ahead to do it. So now, we are not here to judge anybody or dwell on why you are smoking, but let's look more on how to make sure that you are able to quit smoking. What does cigarette contain? Cigarette contains nicotine, as I said earlier. It also contains tar. It also contains a lot of other chemicals. And nicotine on its own, even as at today, most recent textbooks are beginning to describe nicotine as a poison. It has no therapeutic benefit whatsoever. There is no therapeutic benefit of any sort that you are going to get from nicotine, that there are not thousands of other substances that are healthier that could give you the same benefit. But because it's addictive, once you start, it's almost impossible to stop on your own. Most people find it very difficult to stop smoking on their own. In the autonomic nervous system, okay, let's not go into that. That is a medical jargon. But what nicotine does is to block the whole autonomic nervous system. It does not even select okay, let me block this side and leave this side, right? In high concentration or in high doses, it gives a different effect than what it gives at low doses. So sometimes you might have it is exciting the system, sometimes it's depressing the system. So it has a lot of disadvantages with no added benefit for the patient, no added therapeutic benefit. So whatever the reason why you're smoking maybe peer pressure, or you just want to be happy, just want to forget about your problem. The damage that the nicotine is doing to your system is worse than the problem that you're handling right now. I can tell you that people had actually had serious issues. It goes from diabetes. It might interest you to know that yes, diabetes is involved, cardiovascular diseases, chronic obstructive pulmonary disease, COPD, is a serious health-threatening challenge that you can get from smoking. It destroys your lungs. You see, there are also evidences of cancer, lung cancer from smoking. If you watch videos, maybe I'll post these videos of what smoking does to the lungs. You don't want to take the next cigarette pack, right? And it begins to give some people some level of psychosis. I have a patient that tried to quit smoking, and the next thing he broke down. He wanted to do it the cold turkey way. He wanted to just stop smoking by himself. And he broke down and had almost a serious mental illness. So he had to go back to smoking to stabilize himself. You see, you are depending on something when it's possible for you not to depend on that thing. My heart goes out to young people when they start this process of smoking, because it's easier to be away or prevent taking cigarettes or other substances that people smoke than quitting it. Quitting it is very, very difficult. So some people just go ahead and use it till they die, right? So I encourage people, instead of quitting on your own, because if you try and you fail, chances are that you will not want to try again. Do you understand? So because of that, you don't want to try on your own. There are experts that are involved in taking care of smoking cessations. There are doctors who understand the process of smoking cessation, and there are also medications that you can use if you want to quit smoking. But what I want to discuss with you is the one that are called smoking cessation therapies that are available over the counter in our pharmacies, that can be purchased. But I always encourage people, when you get these items, you don't manage it on your own. You speak to a professional to guide you, right? So there are people that I've noticed that are not even able to quit smoking with nicotine therapies. They're not able. They've started like nicotine chewing gum or nicotine patch, different items, but they're not able to quit smoking. So what am I talking to you about now? There are chewing gums. There are patches that you can use. They help you to quit smoking. But if you don't use it the right way, you really can't quit smoking. That's the truth. Because there are steps and guides for the use of it. Just because it's a chewing gum that is over the counter doesn't mean that you have to take it anyhow you want to use it, right? So there are steps in taking these things. So let's start with the nicotine gum. Nicotine gum, the idea is to deliver nicotine to your system, because scientists have found out that it's actually not easy for you to go off psychoactive drugs just like that. You have to deliver to your system a certain percentage within a certain period of time, then you taper it off till your system gets used to not taking it. Though there are people who do the cold turkey method, they just stop. They don't care what their system is revolting. So they stop and they insist that they are not taking it again. They're not even taking any therapy until their system comes back to normal, where it doesn't need nicotine to stay, to stabilize, right? Let me use that word. So, but for this nicotine gum, right? Before I go into the nicotine gum, permit me to talk about cigarettes itself. An average cigarette contains about 10 to 12 milligram of nicotine in it, right? So you have about you have to follow this discussion very well from now on. If you're not following before, if you need to write down something down, write it down so that you understand what we're saying. So there's about 10 to 12 milligram of nicotine inside every stick of cigarette. Now, the amazing thing is that when you smoke, you don't take in the whole 10 milligram. Most times, what people take in is about 2 milligram out of the 10 milligram, right? So you are taking in a small percentage, and you might think that's small, but that's not really small. That's why you see, nicotine is very, very, what we call lipophilic. That means it's easy to absorb in the system, right? It can even be absorbed in the skin. Lipid-loving items, they can pass through your skin. That's why people who sit close to you when you are smoking, they might even be taking in more nicotine than you who is smoking, because you take in like 2 milligram, you pump out 8 milligram. Do you understand that aspect now? So now, going forward, when you look at the 2 milligram you are taking in, for you to say somebody is going towards toxic nicotine level, for you to have toxic nicotine level, the one that will harm you, you are possibly going to have about 40 milligram of nicotine in your system. And a pack of cigarette contains about 20 sticks of cigarette. So if you smoke a pack of cigarettes, you are already going towards the toxic level. So you have even passed the toxic level. The toxic level, so for some people, might start at 30 milligram per day. For some people, it's about 60 milligram per day, right? But the challenge is that you might not be taking a lot in a day, but you are taking a certain quantity per day. Consistently, you're exposing yourself. We talked about how nicotine is It's like a ganglion blocker, you know, in the autonomic nervous system. So you are consistently blocking the systems that should be firing, right? Along the line, you begin to have issues. Maybe nothing is happening now. You are 40. By the time you are 50, you begin to have issues with your erectile functioning, with your blood pressure, you know, with diabetes. Then, you know, a lot of other sicknesses that are controlled by the autonomic nervous system begin to break down gradually. These things, they don't happen overnight, but the people who are at highest health risk, are the people who smoke up to a pack a day. And we already did the calculation now to tell you why that is so. In as much as in the health sector, there have been a lot of debates. You know, does nicotine cause cancer? Is it really bad? But ask yourself, does it have any benefit? So why is it being pushed? Even despite the fact that WHO and health organization will put out the fact that nicotine is dangerous to your health. They've even forced the companies that make it to tell you nicotine is dangerous to your health. But truth be told, it's dangerous to your health, but you are addicted to it. And addiction is a very strong thing. It's something you can't possibly do much about. But thank God we're discussing this today, so you have an option of quitting smoking. So if you want to quit smoking with a gum, this is the right way to do it. Smoking, depending on the quantity of smoke, you need to talk to someone to help you analyze the quantity that you smoke in a day. You need to know the quantity that you smoke in a day so that you know the quantity that your system will require per day. If you're not able to supply sufficient quantity with gum, chances are that you are going back to the nicotine immediately. So it's usually divided and tapered off till the last dosage. So what happens the first few weeks, that like the first 2 weeks, is a long journey. Nicotine cessation is a long journey. That's when I see people who are smoking, I'm like, the day you want to quit smoking, that's the day you understand this journey that you have gotten into, right? You know, it's a long journey that takes a minimum of 3 months. Minimum of 3 months for you to quit smoking. So you get the chewing gum. The chewing gum comes at about 2 milligrams of nicotine. So if somebody is already a heavy smoker, what the person needs to do is to be taking this gum like every 1 hour. Like in a day, you're expected not to take nothing less than 8 tablets of the gum. That's eight gums. What do you call it? Is it tablet now? Yes, I think it's a tablet of gum, right? So you are going to take 8 pieces of gum. At least you can go as much, depending on how much of nicotine you are used to, you can go as much as 20 pieces in a day. So what is expected of you is that 1 gum per hour. So in a whole day, you find yourself chewing the gum all through the day. That's the drill. So please, if you are here, you like what we're doing, you can help us share on your wall and encourage people to join the live show. So here you are. You take the gum. You don't just chew it. A lot of people get frustrated when they take this gum. They say, oh, it's not working. It's not working because you're not taking it the right way. So you don't just chew the gum. After you have spoken to your doctor or the healthcare professional that put you on it, and you have come to the stage where you have purchased the nicotine gum, it's your duty to start chewing it. So you chew this gum a little while, and you get this peppery taste in your mouth from the gum. You transfer the gum from your mouth to a place between your cheek and your gum, your own gum. Like you have to put it here, right? Inside your mouth, a place between your cheek and your gum. So it's inside your mouth. You're not chewing it anymore at this point. You have brought out the peppery, or what I would call the active ingredient, active component of the chewing gum. So you place it between your gum and your cheek and allow it to be there for an hour. After that hour, you remember we said that nicotine is highly lipophilic. That means it's able to go across membranes very fast. You don't need to swallow it. No, you don't need to swallow it. So after that 1 hour, you spit it out, you start a new gum. You chew it for like 5 minutes, you get that peppery taste, then you transfer it to the side of your gum. So depending on how much of it that was prescribed for you, that was given to you, you find out that you're supposed to do this continuously for the first 2 weeks before they reduce the dose for you. They keep on reducing it every other 2 weeks until at the third month, you could have been free from the thoughts and the need the craving for cigarettes. There are people who do not like to chew gum. They use the one they call a patch, nicotine patch. But don't make that mistake to buy a nicotine chewing gum, just one packet. Then you take it today, you come back to tell us that, oh, it's not working. How is it going to work that way when you have been taking cigarettes, packs and packs of cigarettes over the years? Your body is used to so much nicotine. So what we're discussing today, remember, is hypertension and how these psychoactive substances can actually exacerbate the condition. If you are already hypertensive and you are smoking, this is the time to stop. If you really want to be truthful to yourself and you want to live longer, this is the time to stop. This is the time to stop it the right way so that you will succeed in stopping. If you do not have hypertension, don't wait till you have hypertension. It's not easy to stop smoking. And it's even more depressing when you are already sick, because people, when they are sick, they're like, oh, I'm already sick, I don't know what to do with myself. Then they begin to give up. You don't want to get to that point where you're giving up on yourself. So you see what we talked about, making sure that to a very large extent, you don't even get yourself involved in smoking at the point where your BP is going high. Do you understand that? If you are lucky, you are not a smoker, and there's a pressure on you to start, please don't start. Psychoactive substances are beyond your physical control, right? So it's not spiritual control, but they call it involuntary control. It begins to control you involuntarily. You can't do anything about it. That you need cigarette now, or you need any of the psychoactive substances, hashish and co, that you need it now. You actually need it now. Your body needs it, and you find your leg going to look for it. Your leg will move. You find your pocket opening up to buy the cigarette. Right? So it's not time to beat up yourself. There's a solution for these things. And what we're still discussing is, as I said earlier, is still based on hypertension and how to live longer. If you have not joined our class, we have spoken about the class a lot of times. We are always talking about our online class on hypertension. If you have not joined, this is the time for you to join and enjoy the benefit of getting first-hand information when it has to do with regards to what you should be doing and what you should not be doing with your system, with your body, and what will help you to live longer, right? And sometimes we feel we understand these things, but until it takes somebody who is a professional to teach you, to guide you into it. So I'm hoping to have you on the show on our hypertension class. You can even register your parents. The more details are on our site concerning this hypertension class. I hope you do have a nice day. Thank you very much for joining our show.